Hi, I'm Dr. Peta Stapleton, coming to you today from Bond University on the Gold Coast in Australia. And I'm here to share with you one of our Now talks. Today what I'm going to talk to you about is EFT, or the Emotional Freedom Technique. We sometimes call this tapping. And I want to share with you about 9 years of research, what we've been investigating here at Bond University. So EFT, like I said, stands for Emotional Freedom Techniques, and often we call it tapping, mainly because that actually describes the technique. Sometimes we might call it psychological acupuncture. And I guess the thing about tapping is, instead of using needles, we actually use a tapping process. So we stimulate acupressure points that are on the body, but with a tapping process instead of needles. So obviously that suits a lot of people a bit better. So we've been investigating now EFT for about 9 years across a range of different topics. And we often talk about EFT being a brief cognitive therapy, but it has this somatic element, which I guess makes it a little bit different to some standard therapies out there. So because we've added in this tapping, this somatic element, I guess it has changed the way people are dealing with their different issues. So it is brief. It does work fairly quickly, and I want to sort of talk a little bit today about how that might be working for things like food cravings and weight issues, as well as a bunch of others. So the thing about EFT is it has been researched. It's been around for a long time now, about 35 years, and has been researched now in about 20 countries. So there's over 100 papers that are actually published. So the evidence is definitely building for this type of technique. So the thing, I guess, about EFT is a lot of people sort of say, well, how does it work? What part of the brain? What's the genius of EFT? Part of that is you can actually bring up on purpose something that's bothering you, and you can do something about it. We do that with this series of touches and taps, and it's no secret, I guess, that that kind of stuff comforts us. You know, we might actually rub our temple when we've got a headache, that sort of thing. And funnily enough, that's one of the pressure points that we use. So it is something you can use on purpose, and it is something you can do at a self-administered level. So once you learn how to do the tapping technique, you can actually do it at home by yourself. So the thing about EFT, I guess, is it is brief, it has got a cognitive element, it's got a set recipe to it. So I want to share that recipe with you today. Normally we would only do the tapping on something that bothers us. So we normally have a problem. So we say to somebody, well, what is the problem? What's your problem? And how would you rate that out of 10? So 10 might be the most distress that it causes you, but 0 would be I'm completely calm and relaxed. So you would just guess out of 10, what's your level of distress or your level of problem here? So we guess that. We then say what our problem is in a statement, but we have an acceptance of that. So the statement itself might go something like, even though I have this food craving, I accept that I have this food craving. So the acceptance part is important of the problem. It really does make us pay attention to what is at hand here. And then we use this tapping sequence. We go through these 8 tapping points, and I'll show you those in a moment. And then we just guess again, or we re-rate our level of distress, problem, food craving, whatever it might be. And we continue doing that tapping process until it gets down to a 0 or a 0. Now, a lot of people do say, I mentioned earlier, or they ask, how does it work? How does the tapping technique work? Why do I feel more relaxed after I actually use it, and maybe pretty quickly after 5, even 10 minutes? And what we know to date is that the amygdala, so a part of the brain that's stored right in the back there, and it's a very primitive part of the brain that's been around for a long time, sends out the stress response when we have a reaction to something. Now, for a lot of people working in food cravings, as I do, it's the amygdala that sends out that craving. So if it was a cigarette that somebody craved, it's the same part of the brain. We also know the amygdala is responsible, though, for a stress reaction or a fight or flight response. So if somebody feels threatened in any way or feels angry, it's still the amygdala. So what we know is that the amygdala calms down through the tapping process. So we know through some, exploratory studies we've done to date on the brain that the amygdala calms down as we tap. What that means is the person doing the tapping feels calmer. Over time, what happens if you stop having the same response to a set situation or a problem, we get different neural pathways that rewire. So that's why if a year down the track I ask somebody what's happening with your food craving that you did tapping on a year ago, they often can't remember what that food was because they no longer eat it. So because the amygdala's become quiet, they actually have a new neural pathway that's formed over time as well, which is very exciting for us in the food weight area because it means somebody doesn't have to use willpower anymore, and we know that willpower doesn't last over time. So after we teach the tapping technique, we obviously follow people through and sort of find out a little bit more, and we explain to them how it works and that they can use it on many, many different things. So as we kind of said earlier, it's the amygdala that's responsible. We know tapping has this effect, if you like, on a whole range of different things, and we know that over time it seems to last because of new neural pathways. So it is new, it is something that has been around in the self-help field for about 35 years, but it's something that we've only just started to test in clinical trials at an academic level in the last decade. So the basic recipe that you can see behind me there outlines those steps. So it is, what's your problem? What would you rate it out of 10? Let's do the tapping sequence that I'll show you in a minute. Re-rate it, and let's do a little bit more tapping if it's not down as low as you want it to be. So if we have a look at what are the points, what are the points, and you might want to do this with me today and if you're following along from home. The first point that we use is the start of the eyebrow. So we just take one hand, it doesn't matter which hand, and we just tap there on the start of the eyebrow. As we're doing that, we would actually say what our problem is. So if it was a food craving we were working on, we would actually acknowledge that as we're tapping. So it might be this chocolate that I'm craving. The next point we use is the side of the eye. So it is there at the edge of the eye, and we would say the same thing, this chocolate food craving, if that's what I'm focused on. Part of that is to remind us about what we're tapping on. The next one is under the nose, under the eye, my apologies there, I'm ahead of myself, and it's on the bone. The next one is straight under the nose. The next point itself is called the chin point, but it's straight under the lips. We would tap there, continue to say what our problem is. The next one is straight under the collarbone, so about an inch underneath the collarbone. The second last one is straight under the arm. And the last one is the dead centre of your head, up the top. So those 8 points constitute what we call a round of tapping, and as you saw, that doesn't take very long to do. So it would be at the end of that 8th point that you would stop and sort of refocus, take a deep breath and say, how do I feel now about what I'm tapping on? And even though that only took maybe 10, 12 seconds, a lot of people will feel a little bit more relaxed at the end of that. They may not have dropped to a 0 out of 10, but they might actually say, there was some shift there, my amygdala is starting to calm down. I'll keep doing it a few more times to see if I feel even calmer. So what we've been finding is it's helping people's food cravings. So it's obviously giving them choice about what it is that they want to choose to eat because they no longer have this intense craving. So I want to share a little bit about the types of trials that we've done here at Bond University. So for a little while now, almost 9 years, we have been investigating food cravings. So we've particularly looked at that in people that are overweight or obese, and mainly we're trying to teach them how to use it for those overwhelming craving feelings. For some people that's emotional eating as well, and for others it might be portion size, so they're not sure when to stop eating or they don't get any feedback response when they're eating about I'm full. So we use tapping on all those sorts of things. So if you wanted to guess what was the most common craving that people actually choose in all of our 9 years of tapping trials, you would find the answer is chocolate. That's what most people out there are craving. So we definitely target that one. And I myself gave up chocolate through tapping 15 years ago. So I haven't actually, I can take or leave chocolate. It does nothing for me anymore. So we've explored that for a long time. We have just run similar to that, the first online trial for food cravings for people worldwide. So we've actually found that by having specific enough videos that people can tap along with, and it is myself they tap along with, that they're getting the same benefits as attending in person. So we have looked at the preliminary data, and 6 months down the track, people are still getting significant reductions in everything we measure. So that's everything from power over food, how much restraint you feel you have, the presence of food in front of you, and things like depression, anxiety symptoms, somatic body sensations, that sort of thing. So we do know that delivering it in the online space can be as effective as attending in person, which is great news for people that might be in rural and remote areas. So we will release that in the next couple of months. So we've certainly looked a lot in that weight. We've also run trials for patients that have had bariatric surgery. So over a year ago, may have had some surgery to help their amount of food that they can eat, but still struggling perhaps with emotional aspects. So we've taught a whole range of different people in Australia and America how to use it for those types of things, very similar to what our normal food craving trials are like. We've also recently had a look at how to use it for things like clinical depression. So we know that depression symptoms will respond with tapping if we again just focus in on what's the feeling, how are you living your life every day, what are the sensations around feeling depressed, that we will get some response there. And comparing to gold standard therapies also shows EFT or tapping is equivalent, so it does help just as well. We've recently compared EFT to cognitive behavioural therapy, and that publication has just come out a couple of months ago. And what we've shown is that EFT is as effective, so it's non-inferior to cognitive behavioural therapy for the food and weight space. And that's good news for people that perhaps traditional therapies maybe don't always reach, or for whatever reason it doesn't work for them, that we now know if we've got other therapies on offer that have had as much rigorous research done around them, that they're legitimate choices people could choose from and make, which is great for us and great for people out there. And the last area that we have been moving into is school students. So based on some of our food research and the fact that anxiety really responds with tapping, we had schools come forward to sort of say, would this help with things like exam anxiety? Would it help for things like, high achieving students and perfectionism, fear of failure? And of course the answer is yes. So we have recently concluded some of those trials with high achieving students. We've had 200 students go through one of those school trials. That publication is coming out soon. And the biggest things that we found a year later, so after a 6-week program, students reported their fear of failure and their self-perceived difficulties significantly stayed reduced a year later. So they felt like they were actually calmer. Their fear of failure actually wasn't present anymore, when we know that a year earlier it certainly was. So again, those publications and taking it into, I guess, those types of areas in life really shows us that EFT is a technique not just for weight and health reasons, but it's a technique that's a stress reduction tool, and it's one that can actually be applied to so many different areas that I would encourage anybody out there listening to explore it for anything they might want to actually apply it to. We know that once you learn how to do it, it's self-administered, so you actually do the tapping on yourself, and it's something that you can actually do at home without having to necessarily book in and see somebody on a regular basis. And certainly there's a lot of really good resources out there that people can access. So you might actually be wondering, where can I go to from here? What is it that I can do? And there's certainly a whole range of different evidence-based websites out there that will give you knowledge about the technique, as well as things like the research and the publications as handouts of how can I follow this through, that sort of thing. So one of the biggest ones is EFTuniverse.com, and certainly my website has handouts that people can download the points themselves and actually have a look at the steps, those 5 steps we talked through, so PetaStapleton.com. Our research here at Bond Uni, of course, is held here, and that can be accessed easily as well in all our publications. So all of those things are there for people. They can actually make contact. Anyone out there today can actually get in contact. We do answer emails and can ask anything that they like, that sort of thing. So we're at a point now, I guess, where I'm very happy to answer any questions that might have come up today. We know that sometimes hearing this for the first time might result in people kind of pondering the ins and outs of how does it work or what could it be applied to, that sort of thing. So certainly open, and if anybody online today wants to ask any questions, they can send those through our Twitter channel here at Bond University as well. So does anyone have any questions that they would like answered?
Challenges come up, like where you find people are more stubborn in certain things, like they keep on wanting chocolate even though they've tapped on it?
Yeah, sure. And sometimes, so the question was, what kind of challenges come up for people in that food area? So sometimes what we do find is food and eating is a bit of a jigsaw. So there's many pieces of the puzzle, not necessarily just one piece. And tapping sometimes needs to be done on many of those aspects, those pieces of the puzzle. So it could be that somebody actually does tapping on a plain chocolate bar and doesn't have any craving for that anymore, but what they find is when they go home a week later, they could quite happily eat a chocolate biscuit. So there hasn't been sort of a transition or a generalisation over to other chocolate things. And normally for someone that means that there's something different about that type of food than what they tapped on to do with, say, a plain chocolate bar, that sort of thing. All it means, it doesn't necessarily mean the tapping has failed. All it means is there's something different that's there that perhaps didn't come to mind the first time you did the tapping. Other people, of course, get a big generalisation effect where they might tap on one particular type of biscuit and it generalises to all biscuits, and they no longer feel like any sweet biscuit just from tapping on one Monte Carlo, for example. So we say, if that happens for you, that's fantastic, but it doesn't happen all the time. So we do get generalisation, but on the other hand, there's often many pieces of the puzzle that we just need to actually apply the EFT technique to, and obviously you still get the end result. Yeah.
What do you feel is the future for EFT now, given that it's shown such success in comparison to CBT?
Yeah, fantastic question. And I think we're still obviously contributing to the evidence base out there and looking at it in different sort of areas of life. I do sort of see this as a fourth wave therapy. Certainly our third wave therapies have, things like mindfulness and acceptance commitment therapy have come through as what we call those third wave. And I see EFT as the next one beyond that. So if you want to call that the fourth wave, I think as a self-administered stress reduction tool, and one that we can teach children as young as 4 and 5 years of age, we're certainly empowering people to take control of their own personal well-being. And I guess looking at a bigger picture of, health costs and access to services, having something like a really good clinical trial program available online will help a lot of people that can't access those kind of services. And once they understand how the technique works, they can use it forever in the comfort of their own home. So I do see this as something that, and I hope one day, is taught in every classroom as well, so that children actually are able to change a feeling when they don't like a bad feeling that perhaps they have, or when a school teacher, kindly sort of says you need to get over something or you need to build a bridge, they actually have a tool of how they can do that. So that's my bigger vision. Yeah.
Can you use EFT to increase positive behaviours as well, do you think?
Yeah, definitely. We always talk obviously about using it for what appears to be the negative. The negative really is just what is happening, the truth. So if you've got a craving or you have an anger feeling, that's actually just what's happening, even though it appears to be the negative. But I think you're right. You can absolutely use it to increase positive. So it might be motivation. It might be, I've got some motivation for exercise, but I'd love to have more. Or I have some time management skills, but I want more. Why don't I use my tapping to actually increase something like that type of behaviour? And there's absolutely no reason why you can't. So it's often when people are in a good mood, they don't think to use something like tapping to actually enhance that. So certainly setting goals and things like that, you could use your tapping to help achieve those, because it might be that you can use it to uncover a sabotaging belief or something, but then also increase the positive feeling associated with how you would feel when you achieve that. So absolutely, there's no reason why people couldn't eat more fruit and vegetables by doing tapping on that kind of thing. Yeah, it's great. No questions from online? Fantastic. So we're almost at the end today, and I just want to thank everybody online who's listened, as well as obviously everybody here today. It is a new field. It is something we're starting to explore more and more in different areas, and certainly as a therapy technique across a lot of diagnostic areas too. And I'm personally excited about where this will take us, and certainly watch this space for what we're doing here in Australia, because it is groundbreaking. Thanks everybody.